can I ask my surgeon about complications? So I've got the whole question here. Is it acceptable to ask the surgeon in a consultation the number of patients that have had complications such as sepsis, necrosis, and major infections? And if so, how should a person approach the surgeon with this question? How should we word it? Um, right. Okay. Well, yes, it is completely acceptable. One thing I would say is that I think you have to know everything before you have surgery, and you have to know these questions. And if you know, obviously you need to be fully informed of all the bad things that can happen, but I wouldn't dwell on the things like, sepsis, terms like sepsis, necrosis, major infections. These are really rare. Well, you have to ask your surgeon, but they're really rare. I know if you watch TV you think they happen all the time, but they are really rare. And what I would say, so the question is saying, is it acceptable? Of course it's acceptable. It's your body, and it's your, you are putting your body in the care of someone else. So you want to know this stuff. You want to know qualifications, complications, all these sorts of questions. Um, and what I would say is that it's a bit like me, the accountant thing. I got that problem. I don't know if you were here earlier with the accountant. Well, actually, this is not a live question, is it? This is someone who asked a question before. Okay, so the thing that is awkward asking the question because I saw another accountant and I had to say what's your qualifications, and it's awkward. I feel, you feel awkward asking that because you see everyone looks smart and you think that. But what I would say that if someone has got really good qualifications and has got low complication rate and is confident with their ability, they will be quite happy to talk to you about this. So I would say if they are a bit, I understand you will feel awkward about it. And I get that because I think I would feel awkward about it if I was having surgery and I said to the surgeon, can I just ask you about your complication rate? Um, it is awkward. But I think, it's okay. And I think if you are, the way that I look at it is I will, our job is to tell you what's out there. Our job is not, we're not selling stuff. We're not selling, well, even if you are selling stuff, even if you are selling a TV, you don't want to make out stuff that's not right about the TV, because if they get it home and it doesn't actually connect to the internet or doesn't do something you thought it would, you're going to be unhappy. You're not going to recommend that TV salesman. Maybe a TV is not a good example, but the point is, I will say to people, like, infections are very rare. So it's hard to give an infection rate because it's just rare. When you think about things with breast implants, it's if to have a cosmetic augmentation get infected, it's just never happened. So it's because it's never happened. You can't give a percentage, but it does happen. But it's a small percent. So it's not very helpful. It does it does happen to people, but so rates are difficult. But like, for instance, so there's two things really with this. There's complications and revisions. Complications are things that happen within 30 days. Revisions are things that happen after 30 days. So like, people ask me about that, and I've got a 7, well, last time I looked at it, I haven't looked at it for a while, but it's about 7% revision rate, which is average. And but that's not all necessarily all bad, because you're doing little nips and tucks and things like that. Complication rate is different, and I think it's reasonable to ask it. But the problem in plastic surgery, although despite the programs, you would see it is rare. As I say, you get about one hematoma a year. I've had one seroma in about 10 years for a tummy tuck, no implant infections. So from cosmetic breast augmentation, I'd give a rider there. When you do reconstruction, it's a different thing. When you start doing breast reconstruction, people have radiotherapy, then you do get infections, you do get complicate a lot more complications with that sort of thing. But for cosmetic surgery, infections are rare, and it can be difficult to give a rate of complications. So I normally say, look, get about one hematoma a year, and seromas are very rare. Necrosis is a sort of quite an inflammatory sort of term, but skin death and skin not healing up, you can call it necrosis if you want, but a little bit of wound dehiscence, wound not healing up, it's not, it's a potential for any of this surgery because it's done tightly, but usually it doesn't need any more surgery or anything. You're just using these dressings. Um, So I think it's fine to ask the questions, and I think if you see how the surgeon handles it in a way, I think they might not. Don't be surprised if they don't give you tangible answers. You know, if they said it's 2%, I'll be thinking, okay, that's quite high. You know, if because it's less than a percent, it's usually pretty low. These sorts of problems, so they might not be able to give you a percentage because I can't give you a percentage for sepsis, necrosis, and major infections because when did I last have a sepsis, necrosis, or major infection? You know, it it happens, but it's like 5 6 years ago. So it's a really difficult question to answer. But I think I would say you got to see how they answer it. That's the thing I'd be looking out for. And if they feel guarded, if they feel if they make you feel uncomfortable, then I think, oh, maybe they're not that sure of themselves. How you should word it, I think it just you got to say, look, you know, what's the chances of me having the complications? Do you get many of these complications, or I don't know. Yeah, it's a difficult one.